Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hi, I'm Adrienne Asta, licensed massage therapist and president of the Massage Therapy Foundation. This is part 2 of my conversation with Carol Osborne and Michelle Kolakowski, co-authors of Pre and Perinatal Massage, along with David Lobenstein. Please welcome Carol and Michelle in the second part of our conversation. How about positioning? Can you tell me a little bit about the position that they're in order to get this work?
Yeah, that's a really relevant question. They did do this protocol with the patients in side-lying position. We were not able to establish whether they were in a hospital bed or on a massage therapy table, but they were also given the choice to be in, and the words were used, a massage chair. So those were the positions that were used. And they described the use of the sideline position using 5 pillows for support. They had a pillow for the head. They had one for the abdomen, which we were really excited to, because that's a very important comfort and safety measure, post-cesarean in particular, to keep and no pull on that incision, right? And then there were 2 used between the legs. And then they had one that was used to wedge the sacral area. And this was one of our questions that we didn't get answered. In the protocols that we have developed for side-lying positioning, we couldn't come up with a rationale postpartum or prenatally why you would wedge the sacral area, but it may have been something unique to whatever sacral technique that was that they were doing on the sacrum, right? But we were very thrilled to see that this was done in the side-lying position and with more than just throw a pillow under the head and one between the knees. And it does matter, how the client is positioned as to whether the actual protocols are going to be beneficial or not. It actually can put someone in a bad, unsupported sideline position. It can actually exacerbate pain. Right.
What about the process of getting someone from supine or semi-reclined to side-lying after a cesarean? I would think that abdominal strength needed to roll onto your side would be something we should be concerned about.
Yeah, that's a great question, Adrienne. I experienced that every day that I was at the hospital because women's lower abdomen hurts. So the thought of sitting up is they're not really sure how to move. So some simple guidance with having clients bring their feet up underneath their knees, flat on the table or the bed, and gently lifting their hips into a bridge position and then moving the hips to one side or the other. And then in the hospital setting, the beds have side rails that the patient can gently reach for to help turn their torso. But we do want to protect the lower abdomen and that incision site. One of the techniques we recommend using is to have a small pillow just placed over the abdomen. So as the client's turning, that the abdomen is supported and that pillow just goes underneath the uterus on the underneath side next to the table to continue to support the incision and the surgical site, as well as the uterus that's still involuting and becoming smaller. I mean, the top of it is still at the navel. It's still an abdominal organ, not a pelvic organ again yet, not for a couple of weeks.
And my next question is, these benefits are shown over and over again across populations. And it seems so obvious that this is an effective, efficient, economical, and profound intervention. What's the barrier to care?
I think there are a couple of things. I think we need to educate our expectant families about these options and let them choose hospitals and healthcare facilities that offer services like this. I had the privilege of working at a hospital that is part of a larger organization called Plaintree, and their philosophy is to integrate high-touch therapies into the care of their patients. And so, we had many a patient who told us the story that they flew in. We had a patient fly in from the Virgin Islands to give birth. She flew from the Virgin Islands to Colorado because we had the kind of services that she wanted. Expectant families can go on to the Leapfrog report, and they can look at hospital statistics. They can look at the services. They can look at what's available, and consumers need to choose, where they want to go. I think the other thing is having advocates in the healthcare system. Some of my best friends are certified nurse midwives, labor and delivery nurses, and obstetricians, and you find your advocates in that field who want to provide and want to follow the Joint Commission standards of let's offer our patients a non-pharmacological alternative to manage their pain. And in nursing, there's also this concept that's mentioned in the study about helping patients transcend their health challenges. And pregnancy and giving birth isn't a health challenge, but sometimes labor, and certainly having an unplanned cesarean birth, is something that the mom has to reckon with physically, emotionally. And so to be able to refer to these nursing principles of helping patients transcend and using approaches that help patients do that, and getting more nurses trained as massage therapists, right? Collaborating with those people and being creative. The hospital that I worked at, prior to our massage therapy program, we used to give steak dinners to the families, right? Here's a gift certificate, go have a steak dinner. And then they started giving them the choice, if in the pilot study, would you rather have a massage? And almost everybody chose the massage, and they were 30 minutes long. And, this little pilot study showed to leadership that, hey, this is what the community wants, number one. And then the challenge was, how do we give it to every patient, 365 days a year? So you have to have a team. There were 12 pre and perinatal massage therapists who worked on our team, and we covered every massage. We went in and did 3 to 6 massages a day, and we did thousands and thousands of massages. And it was just so gratifying to see, a mom in pain, a mom saying, I'm having difficulty bonding with my baby, because I'm uncomfortable and I just am so overwhelmed, for example. I remember this one patient, and her baby started to cry in the bassinet nearby. And I said, can I bring baby into bed with you? And she's inside lying, and baby's there, and she soothes the baby beautifully. And then I'm massaging her back in this beautiful rhythm and cadence. And next thing you know, she's stroking her baby in the same rhythm and cadence. I'm like, there it is. There it is.
Amazing.
And right. And I asked her, what's your pain level before the massage on a scale of 0 to 10? And it was a 7, 8. And after the massage, it was a 1, 2. Ta-da,
Man, it's great news. Let's keep going.
Yeah. And,
So-
piggybacking a little bit on that about allies, the people who did this study were nurses who were also massage therapists. Several of them were, and they had other allies in this hospital who were behind the study, right? And who really felt enthusiastic about the study. And of course, we're really enthusiastic about it too, but of course, we do need to talk about, I think at some point, some of the limitations of the study. And, one of the obvious ones that Michelle already pointed out is the small sample size, which is, that's the way it is, that's the way it is in massage therapy. Though I would point to those who are interested in this intensely. Interestingly enough, the doula studies that have been done around the world at several different teaching facilities and hospitals that have thousands and thousands and thousands of subjects. Doulas aren't massage therapists necessarily, but they oftentimes are doing lots of hands-on touch during a labor. So it's labor and postpartum, so it's a different time, a very different time. But the studies that are done there with the benefit of doula's presence and their touch is absolutely stunning on the reduction in use of pain medications and pain during the labor, and outcomes for the babies and the moms afterwards, reduction in the need for these unplanned cesareans. And interestingly enough, in those studies, they too had a control group, which included someone who was an observer, who didn't interact, who just observed, right?
Sat in the corner.
Sat in the corner, right? And observed the labor process. And those people, they too had reductions, though not as great as the ones who had doula care, right? So while this is a small study in terms of the numbers of people who were involved in it. Michelle, you want to talk about some of the other limitations on it?
Yeah, the demographics at this hospital in probably in the Boston area, somewhere in the northeast part of the United States, probably don't represent the demographics of the United States completely. So, in future studies, we're hoping that they can diversify the demographics more and take a look at, let me get to the, the authors also mentioned that they gave them scales to give their initial pain, stress, and anxiety, and to give them after, which they knew which intervention group in future studies. We'd love for them to maybe consider, I don't know, how to hide the massage group, because, everyone wants a massage, right? Sounds better. I would need a massage, but let me see what else.
Well, and then on that, if I don't report a pain level that's high enough, or a stress level that's high enough, will I get my massage? So it was kind of interesting that group, their initial pain level and anxiety and stress level was higher than the other two groups, right? And so we kind of scratched our head a little bit and went, maybe they're afraid they'll get thrown out of the group, if they didn't meet some sort of level, I have to be a 6 out of 10. I can't be a 4 out of 10. So I best emphasize, and elaborate on my pain level.
Yeah. I actually wanted to come back to something, Adrienne, when you asked about how can we get this? How can we get this happening? How can we get wheels on this?
Yes.
Another thing I think that's really important that everyone is concerned about is the opioid crisis. And there's been a significant amount of research already done in our field about the benefits of massage for pain management. But I want to kind of contextualize how important it is with this population, because opioid use after birth can have a huge impact. So just in the US, 86% of women are going to give birth at least once, right? And if they're exposed to opioids, regardless of whether they have a vaginal or cesarean birth, that is really significant. 4 million women in the United States give birth every year. A third of those will be by cesarean. So studies show that postpartum initiation of opioid use is also associated with persistent opioid use after the birth. Just as one example, at Vanderbilt University, they did a study in 2018 with their population in Tennessee. They tracked over 102,000 women who'd just given birth, and they estimated that 21,000 of those women would become chronic opioid users, and that could be directly attributable to opioid use in the postpartum period. So to contextualize that again and bring it down from big numbers, that's 1 in 300 women who were in these studies who were what they call opioid naive, right? They hadn't used opioids in the previous 180 days, and they were significantly at risk for becoming persistent opioid users. That gets everyone's attention. There's also, research that the opioid use during lactation for moms that are breastfeeding, it is associated with central nervous system depression for the infant. Opioids need to be administered in a medical setting under supervision. They have a role in pain management. Cesareans are life-saving procedures, and it's beyond the scope of this podcast to get into why we have a third of women in the United States that are having cesareans. But we definitely need to pay attention to this critical time in a pregnant person's life when they're giving birth and inserting opioids, the impact that has not only for the pregnant and laboring person who's becoming a parent, but also for their child. So that's a really big incentive for us to look creatively at solutions on what other things can we bring into the mix. And that's what this study shows, that massage therapy plays a vital role in being one of the alternatives that can be brought into a medical setting very early, day 1, day 2, before these pregnant or laboring and postpartum people go home with their newborns. So it's a really important issue that I think we all care about.
This gives us as practitioners just a really easy go-to, and resource for me to take to all of the local OBGYNs, all of the local doulas, and say, hey, how can we collaborate together to just make this easier on everyone? Everyone wins with this situation.
Mm-hmm.
So I really appreciate all of the benefits and insights from these 2 articles. I would love to have you back on and talking about the holding the space and letting them process the birth. I feel like that is going to be, it's a key component to the therapeutic relationship to be able to hold that space. And there is a mastery to it that makes us stay within our scope and, direct them toward our scope, but still be beneficial in helping them process. And perhaps teaming up with some local social workers and whatnot in order to support the community. Carol Osborne, Michelle Kulikowski, thank you so much for coming on this podcast. What a thrill for me personally and professionally.
Thank you, Adrienne. It's been a total delight. And we would like to encourage the listeners to check to the resources that are accompanying this podcast, because this research studies themselves are very inspiring as well as informative. So do check them out.
If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.